What are the stages of cervical cancer? Explained simply. Imagine a journey through the body where we see how far cervical cancer has traveled. Understanding these stages helps doctors decide the best way to treat and gives patients a clearer picture of what's happening. Cervical cancer stages are classified using a system called the FIGO staging, which looks at how much the cancer has grown and whether it has spread beyond the cervix. In the earliest stage, called stage I, the cancer is only in the cervix itself. Within this stage, there are smaller divisions. Stage IA is when the cancer is very tiny and can only be seen under a microscope. If it invades 3 millimeters or less into the tissue, it's called IA1. If it goes a bit deeper, more than 3 millimeters but not more than 5 millimeters, it's IA2. Moving up to stage IB, the tumor is larger but still confined to the cervix. If it's more than 5 millimeters deep but 2 centimeters or smaller, it's IB1. If it's larger than 2 centimeters but not more than 4 centimeters, it's IB2. And if it's bigger than 4 centimeters, it's IB3. When the cancer reaches stage II, it has spread beyond the cervix but hasn't reached the pelvic wall or the lower part of the vagina. Stage IA means the cancer has spread to the upper two-thirds of the vagina but not to the tissues around the uterus. Stage IIB indicates the cancer has spread to the tissues next to the cervix, called the perimetrium. Stage III shows more extensive spread. The cancer has reached the lower part of the vagina, the pelvic wall, or nearby lymph nodes. If it's in the lower third of the vagina, it's stage III. If it has spread to the pelvic wall or is blocking the tubes that carry urine from the kidneys to the bladder, it's stage IIIB. When the cancer spreads to lymph nodes, it's classified as stage IIIC with further subdivisions. IIIC 1-4 pelvic lymph nodes and IIIC 2-4 lymph nodes above the pelvis, called periaortic nodes. Finally, stage IV is when the cancer has spread to nearby organs or distant parts of the body. If it spreads to nearby organs like the bladder or bowel, it's stage IVA. When it reaches distant organs such as the lungs, liver, or bones, it's stage IVB. Knowing these stages helps doctors understand how far the cancer has advanced and guides treatment options. Early stages are often more treatable and may have better outcomes, while later stages usually requiring more complex approaches. It's essential to discuss individual cases with healthcare providers to get personalized information. Remember, each person's situation is unique, and ongoing medical advances continue to improve how we diagnose and treat cervical cancer. Always consult a medical professional for advice tailored to your health.